Welcome to the Ty Beal Show, where we discuss food, science, and life. I'm Ty Beal, a scientist at the Global Alliance for Improved Nutrition, or GAIN. My guest today is Dr. Purnima Menon, Senior Director of Food and Nutrition Policy at IFPRI, and a world leader in advancing global nutrition. She has spent her career turning cutting-edge research into practical policies that improve diets and health for millions of people around the world. In our conversation, we discuss the biggest challenges in global nutrition today, how to bridge evidence and policy, and what leadership is needed to transform food systems for the future. A quick note before we start. This podcast is separate from my role at GAIN. Okay, let's dive in. Dr. Purnima Menon, welcome to the show.
Hi, Ty. Thank you. Really such a pleasure to be here.
We were talking before that we really never met each other, but we feel like we know each other.
Yeah, kindred spirits on social media platforms, you find them everywhere. So.
Yeah, and I think our research has intersected so much. It feels like we're in this very small, tight-knit community, even though we haven't really worked together directly.
Yeah, exactly.
So
we care about what people eat.
That's exactly right. We're passionate about it. So you are a world leader on both the research and the politics of global malnutrition, which can be rare. Oftentimes people focus on one or the other. I'm curious to know what inspired you to address this issue of global nutrition. How did you become where you are today at this sort of intersection of research and policy?
How long should the story be? Okay,
it's up to you.
Yeah, well, it's funny because I've been reading recipe books since I was eight years old. As my form of decompressing has always been to read recipe books and books about food, and so I was always passionate about food. I studied nutrition in undergrad, thinking I wanted to be a restaurateur or a chef. I then got hooked on the biology. I then did my master's, sort of more to go a little bit deeper into nutrition. Got exposed to the public health side of things and realized, how much more of interest that was. And then after my master's, I just had a wonderful opportunity to work with Dr. C. Gopalan, who is the father of nutrition, if you will, in India. And a lot of what I did there was really look at the latest science and think about how it applied to sort of policy directions in India. I then had an opportunity to work with IFPRI for a while as an intern. And by then I was really hooked on this idea that, that research was an important part, or building evidence on nutrition was interesting, was an interesting pursuit in and of itself, but also that evidence could shape some big decisions that, governments would make about where to take strategies. So I was quite hooked by that. And, I guess I've always been sort of very science-minded. I studied, science in my high school as well. And so I feel like, this space that I'm in, where I get to really engage on research and research directions, but I'm also really thinking about how does it connect to the real world? How does it connect to people? How does it connect to decisions that governments make? That's what has always been inspiring to me. And then, as part of my PhD experience at Cornell, and then sort of a 5-year period after that, which is when I think researchers do some of their, deepest individual work. And that sets us up for many years after. I had the opportunity to work with such a diversity of sort of science mentors, if you will. I had a chance to work with Gretel Pelto, who passed away recently. She's an anthropologist. My advisor.
Such a sweet lady.
Such a sweet person, really, and so influential. Had a chance to work with, Marie Ruel, Lawrence Haddad, David Pelletier, Jean-Pierre Habicht, Ed Frangillo, people that sort of took me down deep paths in terms of thinking about things. But One of the things that I really took away, for example, from many of these, but especially from Gretel, because I had never really encountered anthropology before, was how important it is to understand people in any change process. Whether you're looking at people in the context of nutrition, behavior change, and dietary choices, people as implementers of programs, people as decision makers and policies. So I'm really motivated by this idea that change comes from people, and that we can really use both research and policy efforts to to connect
Mm.
the dots and move people, entire ecosystems, to begin to think about and do things differently. So I guess it's a bit long, but it started a long time ago. So.
I love that you're talking about people and what sort of moves them, inspires them, what sort of motivates people, because I sort of see research oftentimes as disconnected from the reality of people's decisions and day-to-day things. Like, you can model something, but what actually happens in the real world? And I think that perspective is so important. I have a geography background, and it sort of overlaps with anthropology a bit, where
Yeah.
you're looking at like human behavior, and I think that's fascinating and actually pretty critical. So it's pretty inspiring, your work, and I've been a fan of your work for many years. We've worked on some shared projects like
Yeah.
the Adolescent Nutrition Project, and what you have sort of been involved with over the last few decades in this food system space, working in lower income countries, middle income countries, and trying to address things, moving more and more into newer things like climate, and how do you do things equitably and all of this. Can you tell us, sort of, as nutrition has changed, as the situations have changed, what trends or shocks in these food systems? So this could be climate, conflict, supply chains, whatever it is. What of these things really worry you the most right now and really require attention?
Oh, yeah, so many, right? So again, I think um, I worry a lot about I worry a lot that we think about solutions in silos. Um, I think it's okay that we deliver things through sort of sharp systems oriented ways. At the end of the day, there are certain design features to how governments operate. There are design features to how money flows in different systems. And, they are what they are. Government budgets are often, you know, tagged to ministries, and maybe private sector money also flows in certain very particular ways. You can't really move that around. What we can move is how people think about how that money is used and deployed, right? So that's what I'm
Hmm.
thinking about. Like, how do we work with um, food systems are complex. People's lives are complex. They hit, like everyone says, it's not like people think in sectors. You think about your whole day, you think about time, you think about your money, and sort
Right.
of very in very complex ways. And you're always making decisions about how to optimize, all of those things. But the way implementation systems, if you will, governance systems are designed, I worry that maybe we're trying to do too much to get people to do, to really be we can't do everything together. We can certainly see the world together. We can understand it together. But even the oldest writing on multi-sectoral programming in nutrition, was always very clear. Understand together, review together, do as you will, in your sectors or pathways, and then continue to come back to review, is this the path we want to move on? So I think what we need to do collectively as a global community is uh, take the system, know that it's being shocked in different ways, because of either changes in how conflicts are increasing around the world, or the ways in which climate change is affecting especially the most vulnerable. But we also have to really be able to break it down to bring it back to basics and say, okay, so what does that then mean for how a health sector budget is used in 2025? What does that mean for how agriculture budgets are used, in any government in 2025, 2026. Like, we have to get to very, very practical and pragmatic solutions. As someone who is, really, for us and for me, why we care about research and evidence in that is that it gives you the best bets. It's amazing that people have great ideas, but when you couple a great idea with great research, you get to proven best bets. I want to see us be able to deploy these proven best bets through these systems that operate the way they do. I think we're going to be able to move faster that way than saying, we need sort of very mega complex joint up, whatever else. It's hard, right? I mean, I've connected enough with policymaker counterparts, and the time frames in which people work in those systems are much shorter than, say, somebody who stays in the world of food systems or nutrition research for 40 years. And we just have to learn to be a little bit more nimble with sort of getting to the pragmatic, implementable best bets that move the needle, and ideally not move the needle at cross purposes, right? That what happens as a best bet in agriculture for a certain goal is not operating at a cross purpose to what needs to happen in the health sector.
Yeah, looking for
So
those win-wins whenever possible.
yeah,
Yeah.
exactly. And the part about shocks, I mean, this is it's almost a reality, and maybe it has been for a long time. Maybe it's just that today the global community, is much more um, aligned with the idea that, in fact, poor people's lives have always been affected by shocks. We have been collecting data in our surveys for maybe 35 years on how the poor respond to shocks.
Mhm.
Whether you look at it in the context of livelihood resilience, or you know agricultural crop failures, or livestock losses, or illnesses. I mean, we have understood that the poor have always had to deal with shocks. Um, so personally, I'm just glad that we have now the whole world thinking about how shocks are affecting our systems.
Yeah, because we live in a global world, very much interconnected now
Yeah,
more than
yeah,
ever, and
yeah,
everything from a conflict in one part of the world can affect to like the emissions and the climate impact can affect other parts of the world, right? And
yeah.
it's
Exactly,
so.
exactly,
But when we think
exactly.
about, you're talking about these sort of practical, real world applications of things, of policies, and trying to use really evidence based things that are grounded in evidence in the practical world of like a country, right? You're based in India, you've lived in the US and India. When you're thinking about, we have this global effort, which unfortunately has been really undercut by the funding cut in the US. But we have these global policies and even a national policy. How do you balance that with what the local needs are to make sure things practically are implemented and meeting needs? Like, how do you balance those, global efforts and global research and global guidance versus what is really going to be the most beneficial down at the local level?
Yeah. Well, I really like to think about things in sort of a policy cycle, right? And I like sort of Kingdom's model quite a lot because it cuts across, helps you think about, agenda setting, and this interface between policy problems and policy solutions moving along in a stream, right? Like that's just sort of the reality of how things work. And so I think about the work that happens in terms of global communities coming together as keeping problems alive that a collective of people who follow fields for long times, entire careers, are saying, listen, pay attention to the fact that people are hungry, or that people are malnourished, or that the impacts of climate change are inequitable. That it's really important, this work that happens globally, to set agendas. uh, I think there's also work that's happening globally on sort of consolidating things around, okay, these are your best bets, or your best buys. This evidence comes from around the world. So if you care about, say, nutrition, say, or if you care about children dying from say, being wasted, there is a solution basket there that is evidence-based, where people have generated insights on how to implement it, how to finance it, etc. And, then countries can decide, A, is that problem a real problem for your country? B, you know, can does that set of best solutions work for you, right? So that's how I see that interface between global agenda setting discourse and the connections with what national and local communities need to do at the end of the day. And understand that there's always going to be a push-pull dialogue, as there should always be in democratic societies, where a government will take a look at the entire problem scape that the global development community puts ahead of them, and then will make some choices, right? To say, okay, you know what? We're going to lean in on malnutrition. We're going to lean in on climate change because that really matters to us. In our context, it is something that's, we see it, in politics. It's something where we have, viable policy instruments that we can finance or figure out, and that we can implement. Because, at the end of the day, governments are, and that I'm really talking just about governments here, because so much of what we do on policy interfaces with that. But governments will often stand and fall not on the basis of an issue that they take on, but actually on the basis and the results of the implementation of the policies, right?
Yeah.
Does the implementation of the policy work? Does it deliver, the kinds of things that are also important and viable in a political frame? Does it create jobs? Does it reduce or manage food prices? Does it exacerbate or reduce, challenges related to, say, malnutrition or food security? So the work, I think, that is done globally is really, really important. But if it's done in ways that don't, really help national governments and entities move forward in a way that aligns with their priorities, and I think it'll always be a little bit slower. So I really appreciate the many, many conversations that are happening now about who's included in quote unquote global rooms, right? The more we shorten the distance between what, national priorities and experiences are with, what, say, an otherwise, global community that's not necessarily as connected uh, to active efforts in some of the countries where you want to see accelerated change. So yeah, I think, I'm really appreciating this newish, if you will, way of saying, the global itself needs to move back and forth between local to global, global to local. How do we build this, build the solidarity of the sense of purpose, but also of saying, we have implementable best bets that people are willing to stand behind in the places where those best bets need to be implemented.
Yeah.
That's how I think, and I think about this. And organizations like yourselves, at GAIN and IFPRI and others, I think we have a great role to play here in that back and forth that needs to happen.
Yeah. That resonates with me. One of the things that Gain has done recently over the last several years has been shifting staff to our country offices. And
Mhm.
so there's more that is sort of being taken on at the country level where we're doing our work. And it is really, I think, important that there is this open communication where all parties can kind of learn, and a very inclusive process where there's not any sort of here's what needs to happen and this is what you should be doing, but sort of here's the evidence, here's the
Yeah,
coordination, here are the resources, and what are your priorities? How can we help support meet these needs? I think that is a much better way forward than maybe it was a few decades ago. I think where it's a bit um, disconnected, even though there's good intentions. I think that that's really important. Do you see a need for institutions to change, research organizations, civil society, NGOs, to make adjustments to sort of address these issues in better ways? I mean, did you see this already
absolutely.
happening? Yeah.
Yeah, absolutely. And it certainly has been happening. I mean, we have also been at IFPRI are much, much closer to our policy counterparts now. I think more than anything else, it improves both the relevance and the impact um, of the research. It means a lot that people are in the same context and are able to assess, how to find, deliver high quality research that's also relevant, usable, and, can be impactful, right? Um, I think, the road ahead it's not just about whether, I think we have to change, but we have to change primarily to be able to deliver the best possible impact that we can, right?
Yeah.
And a lot of that impact comes from learning. I mean, if we're doing policy research, actually being as close as possible to the settings where those policies are made, um, improves our research, among other things. And so, yeah, that's definitely, I think everybody needs to think about it. I mean, of course, in the world of development research itself, or global health research, there has been quite a lot written, in the last, I would say, nearly a decade now on, where and how research is done, how it's funded, what is the value of, different types of entities in, what needs to be a global ecosystem of knowledge generation, right? I think in as much as research needs to be locally relevant and rooted, you also want to make sure that there are mechanisms, entities, financing, and other things that help look across how things are operating in different settings and close the gap between, sort of really take the local to global, if you will. Yeah.
But yeah, there's a lot of unevenness in this world. And one of the things that I think you've been involved in is sort of obviously in terms of poverty and general things like that, the unevenness, but also things like gender equity in leadership and in the programs themselves and in the stakeholders the people who we're trying to serve. Um, how do you how do you explain the role for people who don't really get it? How do you explain how gender equity is so important for better nutrition outcomes? Because you're talking about the importance is the outcome. Like the intent and the ideas are great, but you really need to see effective interventions and policies that actually make change, right? That's the ultimate goal.
Yeah. So, at again, I really like the policy cycle, right? Because it's like, okay, you need to say, okay, you first have to articulate and clarify the problem itself. And let me give you an example from our work in Bangladesh. So, one of our contributions to the world of policy research in Bangladesh is something called the Bangladesh Integrated Household Survey. In the first round of the Bangladesh Integrated Household Survey, we piloted for the very first time in a large scale survey the Women's Empowerment in Agriculture Index. Okay, so by putting in new measures into these types of survey approaches, you're able to then describe what that challenge looks like. Our researchers then went another step further and said, well, let's look at the relationships between, the Women's Empowerment in Agriculture Index findings and diets and nutrition findings in Bangladesh, right? So they were able to use that to sort of position a problem statement that basically said, women's empowerment here is really central to what's happening on the nutrition outcomes. And then the next step would be, well, what's the solution to that? So what is the policy solution that you have to offer if you show that this is a problem, right?
Yeah.
So we did, together with the government of Bangladesh, my colleagues in Bangladesh, and I had, the opportunity to be a co-investigator on that trial, an intervention that brought together agriculture, gender dynamics training, and nutrition behavior change training to men and women together. So to couples, right? And then
Right.
we've been able to document not just the short term, but now also the follow-on sustainability impacts of that intervention. And in doing all of this and doing it in the country, you're also interfacing with the policy actors, people in agriculture, people in sort of women's affairs, and people in nutrition, so that the issue of gender and nutrition gets put on the agenda. These are long journeys, but if we don't follow that, piece that you have to measure, analyze, and model, and create these data systems that help you see and connect the problem that you have to test. solutions and that you have to engage in the policy cycles, I think we don't get an opportunity to sort of stay the course on and across the policy cycle. So, it remains for us that intersection of gender, nutrition, agriculture, and food systems remains a very strong, component of our portfolio. It's something that, I've also done, done a lot of work and personally. And I think it's interesting because a lot of that work on gender started with gender and agriculture. But if you take a look at it across the food system, and you sort of come to it at the very end of the okay, what does this look like and where people are cooking and eating and things like that, you realize that actually there's whole buckets of things to still be unpacked over there, right? Women are desperately stressed for time. They are doing both income earning work and household work. There are conversations happening around gender and women in the care economy that are recognizing that women remain very unsupported in their domestic work in most countries around the world, not just low and middle income countries, and that will have and is having profound impacts on what families eat, right? I think we're all. I just think we don't have a choice as to whether you think about gender or not. It is 50% of humanity, and gender dynamics play out very differently across the entirety of the food system. From consumption back to production and production on to consumption. So for us, really it's really central, and the way that we position it and the way that we have to talk about it is by building the evidence. What does this look like? What are the solutions that we have? What needs to happen in policies and budgeting and all of that stuff to to really take that agenda forward?
Yeah.
Yeah, and just sidebar, honestly, I think, on the consumption side, the nutrition community is so concerned today about the consumption of ultra processed foods and, sort of cheap, convenient foods. To me, there's a big gender angle there. It's coming, these foods are meeting families that are extremely stressed for time and often extremely stressed for resources. Um, that is a big gender dynamics problem because women are bearing that load of feeding families quite alone in most parts of the world. So what are we going to do in the food system to meet these needs? There's just a lot to do there. Honestly.
There's a lot to do. It's a
There's a lot to do.
big, overwhelming challenge. I think maybe for listeners in sort of wealthier countries, they think, okay, well, the gender issues in the U.S. and whatever, they're like, oh, those aren't a big deal, maybe, which I think they are. But I think there's that perspective, and then but there's sort of probably also a lack of awareness of how inequitable a lot of things are in other countries. Like in terms of how much time women spend with, in labor and in also in households and in childcare, in terms of who has decision-making power, who has control of resources, all these things, all these factors I don't think the general population is well aware of. And so some of this sort of is probably important too, just like this awareness of what's going on. And like what you're saying is like the data is so important. You can't really make policies without understanding what's going on. And one of the fascinating things, you talked about ultra processed foods. That's the other thing. We have almost never had data on what men and women eat separately. If anything, it's usually sometimes we have a questionnaire for women, very little dietary data anyways, but you actually do see some differences, and you see typically, not always, but typically men consume more of the sugar sweetened beverages and the ultra processed foods. And so there is this component of what are the different decisions and how does that play out? And you can't make decisions that are really based on evidence without the data. And what you're doing is trying to link that. So let's collect the data, let's provide information and insight for people to make more informed decisions to address these issues and the inequities. And we need to be able to not just collect the data, but sort of translate that to simple actions and solutions.
Yeah,
right?
absolutely.
I also know one of the things that the nutrition community has focused a lot on, for good reason, is sort of maternal and child nutrition, especially this first 1,000 days. It's a critical window, right? We all know the importance of that, but there has been a movement I've seen over the years, and we've both been involved in this adolescent nutrition.
Yeah.
It's trying to raise the profile. Can you talk a little bit about what is the importance, like why include or focus on adolescence? Is that something that maybe is important to include, thinking at things more holistically?
Yeah, I think for me, working on that adolescent nutrition series was really, it was a transformative experience. It's not a, it's not I had spent much of my research career working on sort of problem, sort of understanding the problem and testing solutions and looking at policies sort of across that cycle on the first 1,000 days. And so then when, um, George asked me as well to be part of the series. And again, just a nod to George's incredible contribution, bless his soul, also. It was just remarkable, to be in these rooms with people who had spent their entire lives thinking about young people and adolescents, and then a bunch of us would spend our entire lives thinking about, nutrition and food and diets, and to see, okay, how do we bring these two together? So uh, I thought it was a very important moment. And, I also really appreciate that we brought it together around food in a very central way. The paper that you were involved in there, I think, was a very powerful sort of reminder of what an important phase in life adolescence is, because that's when young people really move out of their family determined ways of eating and engaging with the world to building their own capabilities, frameworks, values, and other such things as they look to the future. So, from a generational perspective, it was a great reminder of how transformative that working with that age group can be on issues of food, environment, the planet, and their own future. Separately, of course, there's plenty of people really thinking about, the future of youth and employment. Again, that's a very, very big issue for governments that have large youth populations. And so I think what we see now is there a way to bring these things together? I will say, so much investment, financial investment, has gone into building the evidence base of effective solutions in the first 1,000 days. Whereas I feel like, in that interface of adolescence, diets, and nutrition, um, there just needs to be so much more investment as we look to the future. So, we've done some really interesting work, and with various colleagues on understanding the diets, on, beginning to, build together. Like you're saying, I mean, you have data sets. We need better data sets even on what the intra-household patterns of food and eating look like. What is the difference between what a woman eats, what the adolescent eats, and what the male partner, say, in a household eats. It tells you some very different things. And so, it's a great privilege for us to have been able to, begin to pull some of that together. But I just see that there's a huge landscape ahead of us on solutions. What are the solutions that are really going to work? We know we need to involve youth in the design of those solutions as well, and really understand things from that place. I think Gain is doing some really cool work there. And I know we're also discussing partnerships. So maybe things like this all come together. But do we even, I mean, we don't even have a choice. You have to work on issues that face this, this age group for so many different reasons, just so many different reasons. But, the way we looked at it, I guess, in the series was that it's an age group where the choice making, the values, the principles, the opportunities for lifelong impact are really, able to come together. So
Yeah.
it's very exciting.
It's so clear. It's the sort of last stage in a child's development where they are still forming their brain development until 25, their decision making, things that often will last the rest of their lives. So it is sort of an opportunity, if you intervene and you have positive impacts and you make changes and you have adolescents, which we had this saying, I remember at adolescent meeting, they said, never about us without us.
Yeah,
Which is sort of
exactly.
this inclusive, make sure adolescents are at the table when you're having these meetings and conversations because they know what motivates them. What do they
Yes,
care about?
exactly. Yeah.
Right? We can't in our sort of in our distant, our age gap, the the location, whatever it is, right? We're not going to be able to know the language and what is actually motivating. And I think that's what's so critical. And I see this as a really important sort of opportunity to influence while these right at the cusp of when children are becoming adults and they may have lasting decisions and the way that they eat, the way that they the way that they take care of themselves, how do they live, what types of decisions they make.
Yeah.
So
Gender dynamics too, right? I mean, many of those are set very early in the lives of young people.
yeah,
How what you see in your families versus, what you choose
and they're
to sort of take forward on gender dynamics. Like
yeah,
it's a tremendously influential
it's
period.
influential. And also youth in general can be very influential. They're very inspired.
Yeah.
They don't have the same types of what do you call it? Like restrictions in terms of their, oh, that's not going to work. They're sort of very open to just like, oh, I can change the world, or I can do whatever I want. And we saw, working with adolescents in Bangladesh, this is when I first joined GAIN about 8 years ago, all sorts of ideas about how can we have a movement, even creating a social movement. And there was sort of a joint movement that we worked together with adolescents in Bangladesh to say we're going to make a movement about how we spend our pocket money. It was
Yeah,
called the
yeah.
Pocket Money Pledge, and we've had over 1 million adolescents sign up to say, I have control over how I spend this money. I'm going to choose to spend it on a more nutritious snack to support my well-being and my development and all that. So pretty
Yeah,
inspirational.
I think we
Yeah.
featured them in the Lancet series actually, and actually that series was so interesting because it's the first. So I've been on a few, or at least a couple Lancet series before that, and it's the first one where we had some youth ambassadors on the writing team who stayed with us throughout, and then had their own perspectives on the series that were written by these, we won't say how old
Yeah,
researchers, but
exactly. A couple generations above. Yeah. I remember seeing the release. I think it was in when was that in Japan at ICN, and again, youth were involved in discussing about what does this mean to them. So that
yeah,
was cool to
yeah.
see. I've sort of picked up that you have been talking a lot about solutions. How do we really rise to there's so many problems, so many challenges, and how do we really come up with the solutions? I'm curious to know because you do seem to work a lot of times on sort of the cutting edge of new approaches, of innovations, maybe even thinking about technologies, financing, social institutions. Are there anything? Is there anything that you're particularly excited about for really making a bigger impact? Something that maybe you feel like hasn't really been implemented or prioritized or could be further tapped into? Like, what is it that we should really be focusing as a community on to have the greatest impact?
Um, yeah, so listen, I think, especially in the food system, there's a lot of innovation happening, a lot of new things being tried and tested in different parts of the food system, whether it's to address sustainability challenges, whether it's to address this, how do you get maybe more nutritious snacks in front of adolescents? How do you use new ways of communication to get people to change their, or to choose healthier foods and so on and so forth. Um, and I think about I think about I worry maybe a little bit that the evidence building around those solutions isn't necessarily able to keep pace, if you will. And some of it is because some of the solutions are coming, say, hard and fast, or they're coming, is that the right word, they're coming fast through different parts of the ecosystem, whereas and there's often financing to deliver some of those solutions. Again, it's coming from there's different sources of financing there as well, right? But we also have to finance the evidence building around that, because you may be able to deliver something, a new technology or a new technology for cold storage, or to get fruits and vegetables through the chain, or to get animal source foods through the chain. You may be able to design an innovative AI chatbot to engage with young people around their diets and things like that. But I think about evidence and research as being a legacy repository of what have we learned from those things, right? That's the space that the knowledge and research community fills in this ecosystem of different types of actors trying to deliver change. And if we are not, walking alongside saying, okay, I have a cool idea, how do I invest in research that tells me tells me and the rest of the world that cool idea is actually a best bet, not just I'm taking a risk on sort of developing this innovation, but it's because at some point you need to put these things up against each other and say which ones are most impactful, which ones are most cost effective, which ones should somebody put even more money in, right? And there have been methods of doing that in the world of development research or global health research for a while. But some of the things that are now happening, say in places like the food system, I don't know. I sort of want to look maybe 5 or 10 years out from now and say, okay, when we look back, will we have the evidence that tells us, say 5 years from now, right? Will we have the evidence that tells us that, what, this bank of food systems innovations is really something that everyone should put their money behind, because it delivered, say, incomes for farmers, it delivered jobs for the youth, it delivered nutritious food coming out of the pipeline of whatever that value chain was, it reduced food loss and waste, it reduced emissions. Go, 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 everyone invest in it. This next set, delivered some outcomes, but not others. And so maybe we weighted a little bit less in a future investment portfolio. And then there's a whole bunch of things that people tried. And then the testing showed that actually, you know what, we should not be putting our money into that, either because it didn't deliver primary impact or that it had some really terrible negative spillovers, right? If we are not investing in the evidence ecosystem that walks along with all of this rapid innovation, I worry that we'll come 5 years out and not be able to look back, like we did on the adolescent series, and say, you know what, we've done a comparative analysis here, and these are your best bets. So right now, I think we have a lot of great ideas. I want to be able to say, how are we going to say that those great ideas are proven best bets? That's going to require a research and evidence investment. That's what that's where I'm sitting right now on sort of all the food system stuff, whether it's all proteins or whether it's, solar powered, cold storage, or whether it's, AI chatbots or social media enabled nutrition education. We should be testing these the same way we test other things.
Yeah, you're
And I don't know
right.
that we are.
You're right, because you don't know how things are going to work in the real world
Yeah.
until you try them out. And if you try them out without designing a system to evaluate them, compare them against other options or no options, no implementation or no program, you don't know if it's effective. So
Yeah.
you could have just done something for 5 years that was and a bunch of money that had a big change, or it might not have. But if you don't design, what you're working on is really testing out how do you ensure that these are effective, and not just effective, but which ones are the most effective for the purpose of the issues that the stakeholders in the context care about the most.
Exactly.
Yeah.
Because we want people to put money into things that are effective and that deliver the goods on multiple
And
benefits,
donors
right?
want to see that. They don't want
Yeah,
to invest a
exactly.
bunch of money and then have nothing
And governments
to show.
too, right?
Yeah.
There are many people that are financing the implementation of a wide range of things in the food system.
Yeah.
And I think our job should be to, our best contributions here are to be able to walk along with those people and say, let us all work together because we can help tell some of those stories. I mean, and I say we in a very broad way, not IFPRI, but the broad sort of research and evidence community, I think, has a huge role to play here in this, innovation ecosystem that's very mixed right now.
Yeah, it is. And I think one of the innovations that you touched on was AI. This has been something, I think there's been such little like actual work done. There's a lot of ideas, but in terms of implementing things with AI and seeing if they work, we recently got some Gates Foundation money to kind of do an overview of what has been done, and what are people doing with AI in the nutrition food system space, and really also developing our own strategy to say, for these different types of programs, these different efforts, what are the most strategic things to be trying out, and how should we go about that, right?
Exactly.
We have that. That'll be coming out soon. I think that's going to
Excited
be.
to see it.
Yeah, I'll share it. It's. I think that it's going to be. It's very yet to be determined how influential AI is going to be, but it feels like, it seems like, from the capabilities and the rapid increase in the capabilities, that it should be able to make improvements in optimization and scaling things, right? So hopefully that'll be counter some of the funding challenges. Maybe there'll be some sort of the technological efficiency gains, right?
Yeah, exactly. Yeah. But people eat food, right? So we really have to keep our eyes on that ball as
exactly.
well.
Yeah, I know. I'm curious to know too what your sort of perspective is on this, the issue of animal source foods as it relates to not just human health, but the climate impact. Eat Lancet, it's October 8th today. Eat Lancet 2, the latest commission came out, I think, 5 days ago, right?
Yeah.
So do you have, I mean, you're probably very in touch with the culture and perspectives in India and in South Asia, especially given all of your sort of colleagues in the area and you're living in the area. Do you can you articulate what the reception is to that? Is it generally well received? Is there alignment usually with like policymakers and with your colleagues? Or do you have sort of concerns about anything, like in terms of how much animal source food should we be eating for different purposes? What types of animal source foods? Those types of questions.
Yeah. So listen, I mean, I'll be honest. I haven't yet dug deep into this latest Eat Lancet report, and I knew you'd ask me a question about it. But
I haven't done a deep dive into it either yet.
Yeah, it's definitely it's on my reading pile to get into it. I mean, listen, it's a very influential report in I'm going to say in agenda setting, right? I mean, there's no denying that the last Eat Lancet report really put this idea of eating for planetary outcomes on the agenda. The back and forth that perhaps happened after that first one was, well, we have people are eating for nutrition, and that's having impacts for, or are they eating for whatever other reasons, and that's having impact on environmental and planetary outcomes. Let's find a match. I think a lot of work went into this last series, at least from the people that I know who are on the commission, to reconcile multiple perspectives. In terms of reception in different countries, my guess is, I think there's an India launch a little bit later this year. Later this month. I won't be there at it, so it'll be interesting to see what comes up. But the way that I think about this is, it's one thing for us to say people should, or we recommend that people eat this way or that or the other. What we want to do in the research, and what we've been doing increasingly, is really meeting people where they are, which is, what are their diets looking like today? What are the current drivers of their dietary choices? What does that look like in different settings? And it's when we understand that I think you have the best bet to say, well, if I want to nudge that in the direction of both a healthier and a planetary and an environmentally friendly diet, what are the constraints I need to move, right? If you're speaking with someone in in the mid hills of Nepal, which is one of the areas where we've done, one of our local food systems assessments. And if you understand that the drivers of dietary choices there are shaped by the fact that you have huge male migration, that you have women that are doing everything from agriculture to producing and to cooking for their kids and their small families, that your local food shops are replete with instant noodles and other things that families can make quickly, and that say eggs are too expensive, you start to then think about policy entry points if you want to nudge these eating behaviors both towards better health and towards more environmentally friendly foods. We really have to nail the constraints that people face around their dietary choices, right? And those constraints vary. I mean, all of our work on diet and nutrition related behavior change, whether it's through our work on breastfeeding, complementary feeding, adolescent diets, you know, understanding sort of how men, women, and children are eating in some of these settings, everything points to the fact that each eating behavior or choice has a set of constraints around it that need to be unlocked, right? You want people to eat more animal source foods? Well, you need to unlock a certain set of constraints. You want people to eat less? Maybe it's a different set of constraints or driving factors that you need to unlock. I just don't think we can ever expect that we're going to move, billions of people towards eating differently if we don't invest in understanding the why.
That's so critical, Purnima. That is the driver of why people choose and what impacts their ability to make a choice or the ability
Yeah.
to access to the food, from cultural preferences, right?
Affordability, I mean,
Social
such a big
affordability.
challenge. Such a big challenge.
So many drivers. Like
Yeah.
environment is really ideal from sort of the researcher's perspective who care about that, but like it's pretty clear that that's not the top of mind for a lot
Yeah.
of consumers, especially low income
No,
consumers, right?
exactly. And and some things are just so we I gave a talk at Cornell last week with the Tata Institute, and at the end of it, Prabhu asked me, he's like, so where do you think we need to go in sort of on these improving diet side of things? I said, listen, A, we have to understand these drivers of dietary choice in a much more nuanced way. And B, we need to get much, much, much closer to solving the structural constraints for people and the commercial drivers as well. These two, I think, are where I think, could be doing a lot more.
Mm-hmm.
And, I think about simple examples because if, you go out to meet people in their homes, I remember we did some field visits when we were designing these local food systems assessments in Nepal. And, family that's cooking on a single burner stove and has, two pans in their home to cook on. And maybe, the water is coming from somewhere else. That intersection of fuel, water, literally kitchen infrastructure, with their own sort of other affordability and time challenges, that's going to drive what they make for dinner
Exactly.
that night.
Yeah.
We that is a set of structural constraints that needs to really be understood, unpacked, and resolved. It lies at that intersection of water, energy, food, gender. Um,
Yeah.
so I think we have a lot of work left ahead of us.
One of the
But
things
I
that
want it to be people centered. We have to be human centered in how we find
otherwise
solutions.
you're not going to make any, we're not going to make
No,
impact. You're not going to make
absolutely
changes.
not.
I think when you look at things a bit more holistically, one of the things that GAIN along with FAO has been working on is this review of alternative proteins. And this was Lynette, who was my old boss, who's at FAO now, kind of wanting to do this. And one of the things we did is we said, let's look at this from the nutrition and health perspective. What are the benefits and risks? Let's look at it from the environmental perspective. Let's look at it from the food safety perspective. And then also the socioeconomic things. So we're looking at the price and affordability issues. We're looking at the cultural acceptability issues. We're looking at the impact on livelihoods. And that's not even everything, but at least like it gives you more of these different areas of what really is the impact. And it's usually not always just cut and dry where everything's aligned. There's often these sort of trade-offs of like, well, maybe from the health side, you should do this, but that on the affordability side is going to be a challenge. So how do you address that? Right.
Exactly.
So there's always,
yeah,
it's complicated.
yeah.
Knowing all of these challenges, can you, as sort of our closing last question, do you have sort of one change in institutional practice you would hope to see in global nutrition research over the next 5 years or so to have the greatest impact? What would you like to see sort of changing?
Oh, tough one. I'm going to say again, let's be human-centered, because the change that in all of the research we do, I think you can come at this from different angles, because the change that we need to see has to be, implemented often in people or in communities that face great vulnerabilities. So really being very tuned to the impacts in a very real way on the most vulnerable. And really at the other end of it, I would say, let's also really keep our eyes on, you know, policy incentives, right? Like, how do big incentives work? I mean, even on the all protein stuff and everything else, you cannot do certain things without moving the needle on, where agriculture investments and subsidies and sort of other very um, heavily often vested interests. Where do the politics lie?
Yeah.
So I really, I think for me, it's sort of between people and policy and people, like really going back and forth between those two. Um, I really think that anyone who's testing solutions, thinking about how to deliver impact, has to be able to look at that interface and then choose their path and then, deliver on that. So that's where I would like to see. I'd love to see nutrition research. I think nutrition research is still very siloed. Um, there's people working on sort of straight shot um, solutions to very specific nutrition problems. There's, at the same time recognizing that systems investments are going to be important. But if we don't join the dots, then we will keep asking ourselves, when are those systems investments really going to come? So I'd like to just see a lot more joined up work across what I think is a very vibrant nutrition and food systems community that together really cares about what people eat, what the impacts of that are on their health and well-being, and how can we help to move that forward. Um, I think we're in a place of great privilege to be able to look at think about how our institutions can help on this. And so I do ask myself a lot, what do we do with that privilege? And all of
Yeah.
us should be asking ourselves that question.
Yeah.
Okay.
Well, I'm very appreciative of how much sort of intention you give to that privilege, the opportunity you have, and also your sort of role in leadership to make these decisions and really try to have the greatest impact, keeping it human centered, focusing on what people really care about, what they need, and also trying to address the big policy questions that can influence these things at scale. So I really admire your work, Purnima Menon. Thank you so much for taking the time to speak with me.
Yeah, thank you, Ty. I'm also really a great admirer of your work. So, I could hardly say no when you asked. Thank you.
Of course, my pleasure.